I was
Dr.
just
Paul
going to
Guillory.
test you, Professor, and say, I know you're busy out there in cold uh, Minnesota, but
Yes.
okay, let's get going. All right.
Yes, it's been surprisingly very warm. It's been in the 30s here and 40s, so kind of strange to think about Minnesota in the 30s in January and February.
And
But
it's unusual to hear Africa talk about 30s and 40s as being quite warm. So let's be
is is
I'm
that
freezing
so?
out here. It's 30 and 40s out in Pennsylvania, and I'm from California. So it's like, well,
Yes,
I got used to it. I mean,
yes.
like you, I wear the warmer clothing. I see the fleece on you. Yeah,
Relatable. Wow.
yeah.
Well, Dr. Paul Guillory, it's an honor. You and I know each other, so it's an honor to be speaking with you about this project and interview. And thank you for agreeing to be participating in this project where we're thinking about. So I am Dr. Ronald Asiimwe, and I teach an intro to family therapy class at the University of Minnesota. And so when we're looking at our history of the family therapy field, we know that it's been predominant in most of our models or practices as family therapists have been predominantly developed by white, mostly male. And so we see that as trends continue to change and how therapy in general is practiced around the US and around the world. Um, we really wanted to focus on centering voices and faces of folks from diverse populations that make up the practice of our field, family therapy, couple therapy. And so we are hoping to cover people like you that are doing systemic models that represent diverse groups. And so thank you so much, Dr. Guillory, for being here. So we'll spend about 20, 25 minutes kind of talking through your model and how you got to that model and kind of your thoughts for the future of the field of couple therapy. So my first question to you, Dr. Guillory, do you prefer to go by Dr. Guillory or Dr. G? Because you and I have known each other.
Interchangeably, it doesn't matter. Whatever is comfortable.
Oh,
But yes.
awesome,
Yeah,
awesome.
yeah.
So before I even get into the questions, let me ask you to tell us a little bit about yourself. I know that you're an EFT certified trainer, but tell us a little bit about yourself and kind of how you identify.
I'm a psychologist,
Yeah.
and I have been a clinician for maybe close to 40 years now. And
Mm,
so I've done a great deal of work focused on uh, African American children at first, because I was a child therapist when I first began. And then I started doing family therapy with adolescents. And so that was grounded in the African American community of East Oakland in California. Uh, from that, I began to do couples work as a part of that work, which was more grounded in structural family therapy, but also with influences from the Milan School of Family Therapy. But essentially working with one-way mirrors in the East Oakland African American and community, and we saw some Latino families as well because it was a largely low-income area. And then uh, got interested in couples therapy because I was being asked, as a virtue of doing family therapy, to do couples therapy
yeah.
as well. And you would see dyads of a family that included the parents, and then the focus became their relationship. So I started with learning first the Gottman model, and then he talked so highly about Sue Johnson. And so when I came home from a workshop of Gottman, Tracy, my wife, had just finished Sue Johnson's book where he had talked about her so highly. And I said, oh, that's the lady that Gottman was talking about. So we took a trip to Ottawa in '06 to learn from Sue Johnson. And so I've been struck ever since with how profoundly I thought she was an excellent clinician. And so that began sort of my launch really into EFT and learning that. So what was a merger for me was two prongs with Sue Johnson. It was three prongs. It was her use of voice and wrist and this model for developing emotional experience. And that dovetailed very well with the work I was doing with professional athletes in terms of guided imagery around sports performance and work. And the use of the systemic point of view and the enactment was very consistent with structural family therapy and what I was learning about Sal Minuchin's work, that had just become part of what I was doing in the East Oakland area. And not there's well, and then there was the work with African Americans in general, right? And that had dovetailed with my work in stress that from UC Berkeley, I'd studied under Richard Lazarus, who was at the time the preeminent sort of scholar for stress research. And so this model that we use, which is more emotion-based for assimilating emotional experience that we use, as Magda Arnold's model that she developed sometime in the 60s. Well, Richard Lazarus had developed a similar model, but his was more on cognitive appraisal, is what he called it, in terms of looking at stress response in the moment with a person, not using measures, but using a phenomenological sort of approach to understanding stress. Well, that fit right into what Sue Johnson was doing,
Yes.
and what I still do today.
Yes.
He emphasized the cognitive behavioral. She emphasizes the emotional assembly, but it's adding emotion to the cognitive behavioral piece for me. Yeah.
So, wow. Thank you so much, Dr. Guillory, for that context. And as you know, I'm a big fan of your work. Your book, which you recently published, titled Emotionally Coupled Therapy with African American Couples, Love Heals, really details a lot of your history about how you got to this, to working with African Americans. But for our viewers, I would love you to give us a little bit of history, because emotional focused therapy, or EFT, has a history of being, a lot of the critics today will say it's a white model. It was developed by a white woman. And so they will say it's been predominantly done in white contexts and settings. How did you make the connection between EFT and the African American couples that you work with? What drew you to that? How did you make that shift?
Well,
Yeah.
Even though Sal Minuchin, in his one of his seminal books was Families of the Slums, he was really working with Black and Hispanic families, right? But he doesn't highlight that. He calls them families of the slums, not about social class in a sense, as opposed to culture. But what is true for EFT is true for all the models of therapy, right? So psychoanalytic therapy was mainly based on white patients, and cognitive behavioral therapy or behavioral therapy was based on white patients. So you look at any of the seminal books on theories about doing therapy, they're all based on white clinicians working with white clients, and those of us who are culturally different would learn our models and be supervised by professors and later supervision supervisors or trainers. They were all white, and the models that we were trained on were all white. So in terms of working with culturally different people, all the culturally different therapists who worked with clients that were different from those began to make whatever adjustments or changes they made. They would perhaps ask questions in these trainings or in their supervision about culture, and largely those would be dismissed as not relevant because all people are the same. But we know in medicine, not all medicines work on all bodies the same way. And there are some culturally different bodies that they say, well, you don't use that, you use this kind of medication. And there is research on that. But there was always a lack of research because there's lack of funding for culturally different. But when they are funded, right, they do find differences, and one of those differences might be described as sort of cultural humility, cultural competence. It seems to make a difference. But no matter how much that is said, that literature is like on the fringes.
Yes.
So when a new book comes out about any model, they don't include the voices from the fringes, right? And so it would be the same. If are books on culturally different, it is a separate textbook that says, cultural differences. And let's say part of that chapter 11, if we're lucky, will say something about African context, right?
Yes.
Chapter 7 might be about African Americans. Chapter 8 would be about Latino Americans. Chapter 9 or so might be about Asian Americans. There's a formula to that, right? 20 pages, 18 of which will be about the context. So they will describe the African continent. Not that Africa's a huge continent. Even with Uganda, there are like 54 tribal
56
community, 56,
of
which there are variations of language and also cultural variations about marriage, right? Let alone about anything else, but about marriage.
Right.
And that's true, I think, in largely all cultures. So this even the books that talk about cultural diversity, 20 pages total, 18 of which will be about context. Maybe we get 2 paragraphs or 2 pages about clinical implications. Now, how does that help you, an African, dealing with African context, which you know very well?
Yeah.
And it will be the same 2 pages or 2 paragraphs, more or less, about clinical implication every time a cultural book is put out. And that's true for African Americans as well. So my learning then about clinical implications is so limited, and I don't get to talk to other professionals unless I'm lucky to work in a training facilities where there's enough African American therapists or therapists of various cultures where we might talk about the implications in an expanded way. So my book is a clinical book. It tries to expand the clinical implications, but not drone on and on and on and on and on about context. Not that it's not important. It's that, but how do we wrap that into what I say in the moment and make that clinically useful for our clients? So nowhere, for example, in EFT, other than in my text, will you find like the inclusion in the let's say move number 2, which is assimilating emotion in the moment for a client, that you'll find culture being added to that moment to emphasize the emotional experience that a African man or woman might feel that heightens the emotional experience that we're trying to get them to heighten. So when we know the more it's heightened, the more it relates to emotional outcome. So I don't want Africans sitting in a moment saying, well, that's a white thing.
Right.
Okay, I'm here. I got to do it for my wife. Some way that they get out of their emotional experience that relates to their family or their wife or their children, have to deal with the cultural disconnect about emotion or attachment experience. See, that takes them away. I don't want that. I want them to stay in the experience. And to the extent we know the culture, in their experience, we heighten it and therefore heighten the possibility for change.
That's so powerful, Dr. G. You're beginning to really describe part of the question I was preparing to ask you. You begin to describe a well-known intervention. So maybe let me ask the question again. Within the EFT framework, there's so many effective interventions that we know. But could you describe a well-known intervention from your theoretical base as an EFT trained therapist, trainer, and supervisor? And tell us a little bit about what is the purpose of this intervention and, when do you use it and when don't you use it?
Well, um, empathic reflections are the main, micro intervention that we use. And I just referenced the idea of the emotional simile, which is move number 2 in the tango, which
Mm,
we often use. They're both they're both important, but the empathetic reflections is, how do we hear a story that a person is telling us from a different culture? And you also asked me something that's important. It's like, um, most people would say, in terms of identity, they would say, oh, a Black man. But what does that mean? See, my Blackness is on a continuum where I am evolving and growing to become more balanced in my view of self in relationship to the rest of the world, that I could see the good, the bad, the ugly, and the beautiful of myself, as well as this view that same with another African American man, and realize we may be from different socioeconomic status,
yeah.
but that's a whole nother area which we have been in a way informed to be critical of each other about or praise each other about, right? And but I want to be balanced in that view, because that takes out the colonial, the marginalized sort of wounds that we have living in these multicultural environments, where the marginalized people are, as my brother Kenneth Hardy has suggested, we have invisible wounds. So we walk and talk in this way where we're critical of each other. So I'm saying I'm on a continuum. I'm growing in that
Mm,
myself as an African American man, and trying to learn where are the new frontiers for me.
mm,
In some way, Africa represents that as I interact with you or other Africans. It's like, and as I interact with other African American people or people from
yes.
around the world who have
Yes.
experienced in some ways this colonial issue, or have been privileged in a way not to experience it so much. And to me,
Yes.
you see where the beauty can be, right?
Mm,
And and the good can be, right?
mm,
So I'm growing in that way. And I refuse to use it as a category
mm,
of describing myself without adding the developmental piece that
mm.
I'm developing all the time in that way. And therefore, it's a moving target, right? And
Yeah.
it can show up when I'm challenged. I think that's what Magna Arnold, when she's talking about like move, where we use her in move number 2 as a foundation for where we grow in EFT. It's with an emotional experience. This was the same thing that Lazarus was talking about in terms of stress and coping. When our attachment system gets activated, we can grow. But when we under stress, to either our identities or our life experiences, we can grow too. Those can be threats or challenges, is what Lazarus was telling us. And that if I can get to a place to see it as a challenge, I can grow from that. So we have to be moving parts and lifelong learners, I guess is what I'm
I
saying.
love that.
And but it's only when these things are up and running. Up and running mean like we're under stress or anxiety, or and so in EFT, it's when our attachments are threatened in some way. We have to engage our partners in a engaged, emotionally expressive way so that we can stay connected. I think that's true in stress. So empathetic reflections help us like get connected to this idea of, oh, there is a emotion, there is some stress embedded in this story, and we try to capture that with our EFT perspective in a way that promotes internal self-reflections
Yeah, yeah.
with experience and where the challenge, where the thread is in, and we can experience that in our bodies, which help us if we stay with developing that. The next step is we begin to develop the emotional or the stress experience that leads to growth. So those
Wow,
two things.
that's
Now, we have
very,
to add culture to that because
yes.
people will discount it. Now, they don't know internally that if we're in a cross-cultural situation, that we're discounting the cultural element. If people, or we're not adding it to that self-reflection
Mhm.
in a way that's consistent with how people think about their culture. And we add culture in the beginning of our work, so it's not like in the moment we're processing these things the first time it comes up.
Yeah.
The feeling like, oh, you're culturally attuned. And therefore,
Mm.
when I have these kind of minimizing or deflecting internal thing away, that we can talk about that
Mm.
in the process of therapy before we get to the moment where we want to develop it as an emotional experience or a stress experience, and then have it be a developmental um, movement.
So powerful. Lots of profound points there you made about empathic reflections. I mean, such a powerful tool in the EFT model. And for our viewers, I wonder, Dr. G, if you could give us a model specific example of you using an empathic reflection and how it worked for your client. So if you could think about, a couple that maybe you recently worked with, or it could be an individual where you saw really the power of an empathic reflection in the moment. And maybe within that, I know that you know about confidentiality, so maybe not sharing details about the client, but tell us a little bit about how you use the empathic reflection and how you saw it work with your clients.
Yes, this is a, a, uh, a couple who identifies as African American. The male was born in Jamaica and raised there until he was about 19. Came to the States for education, married to a African American woman. Um, one is a lawyer, one is a doctor, and there was a mediation problem that the woman had to attend, and only mentioned it to her husband the day of the event where she was dressed differently. He noticed. So he said, well, where are you going? She said, well, there's a mediation that I have to go to. And that was the first he had heard it. That was like 5 minutes before our session. And in fact, that was the third mediation that she had gone to about this matter. That now they're both somewhat allergic to emotional experiences. So it wasn't unheard of that they don't talk about vulnerability or emotional experience. And so my comment was, this is where we get stuck. Each of you grew up in a family where you had to be on your own. And for her, it was and both actually for both of them, growing up in white spaces as they went to school, and not wanting to embarrass their families about their or embarrass themselves among their school, makes they wouldn't talk about anything emotional. And so I say, this is how in a way, this makes sense given the way you grew up, always hiding in a way your emotional experience, always hiding both your family and yourself from um, experience. And this is not unlike your parents. who wanted to live in middle-class white spaces, and they hid their emotional experience, they hid their lives from whites as not to get negative projections and critiques and criticism for them. And so it this is the way you also treat your partner, and you've learned to cope with these matters by shutting down. So, am I got that right? Isn't that at this root, these kinds of ways that you were kind of had to address your emotional experiences, and your families supported that? They promoted your achievement. This was so important to them as a way of advancement for themselves and for you, that the emotion part was sort of, you were kind of learned even in your family to kind of suppress, right? And we've talked about how this has created loneliness in you with your family, and that's happening here too. So what would it be like to think about like getting in touch with the experience of going to this mediation this morning? It hasn't happened, but I dare say the stress around this been building up. Can you, would that be fair? My voice changed, I get softer, and for sure. And then we deal with a bit with the buildup, a bit with their how they're feeling some anxiety. Can you turn to your partner and tell them about that? Where you feel it in your body? You said in your stomach. Can you tell them you feel it in your gut? This is where you've been holding this over a period of time. Something like that.
Such a beautiful way of distilling emotion using a powerful tool in the EFT model known as empathic reflections. Thank you so much, Dr. Guillory. I wish we had all the hours to continue with some of my other questions as within that small portion that you shared about the example of the couple that you worked with. I mean, how beautifully you were able to distill the emotion from to incorporate culture. I mean, from what you're sharing, I heard you talk about both their experiences and how they are raised and how you brought that in the present moment. That's so powerful. So as we wrap up this interview, Dr. Guillory, can you think about, so we all of us as practitioners, we face challenges, whether that's a model specific challenges or the cultural context we practice in. Would you describe any contextual challenges you face in practicing according to EFT as an African American therapist?
Well, the the challenge is to be heard.
Mm.
So if I teach and there is a mixture of cultures in a class or participants, there is engaged discussion about culture and so on. If it is among generally uh, white colleagues, both uh, as a trainer or as a supervisor or as a therapist, then you get stuck with having, and this is why there's so much empathy for my colleagues who have to write so much about context, because we just get to talking about context. We never get to clinical implications because they don't think about clinical implications, and they have to be convinced about context, which I think they don't truly believe is any different. And the fallback is, well, we're all human beings. Well, of course, we're all human beings. We bleed when we're cut. We feel when we have challenges to our, our attachments. But the idea of culture being uh, real and having an influence on matters of psychotherapy or feelings or attachments is not seen as real. So there's very frustrating not being heard. And so we're used to it being packaged in a particular way. And so if we package it in terms of context, oh, let's take a moment for context. We get the moment. It's like Black History Month. It's in February. So let's pause every now and then in February, we say something about Blackness. Wait a minute, it's March. Enough of that. We're past that now,
Yeah.
right? And so that's the
Mm.
I think that's what we're up against in terms of the broader psychotherapy field.
Yeah, yeah. Wow, it's this, being at ease with weaving in culture, from what I heard you describe, we being able to weave in culture and its implications in the clinical setting. I love that. So my final question to you, Dr. Guillory, is do you have any words of advice? I mean, you and I know each other pretty well now for over a year, having led the externship training in Uganda with colleague Dr. Elmin Lest. Do you have any words of advice for people who are interested in marriage and family therapy or any other mental health fields, and specifically for those interested in EFT? Because your background, you identify as a clinical psychologist, but from what you're describing and most of the clinical experiences that shaped you, from Manuchin to Sue Johnson, it's the background of systemic thinkers. So any words of wisdom, any words of advice for folks that are interested in EFT, in the field of family therapy, systemic thinking, as we end this interview?
Hmm. Well, I think, being a good psychologist or a good therapist requires lifelong learning.
Mm.
And so I think uh, we have to avail ourselves of various trainings uh, and also experience different cultures. So I would encourage people to uh, take it on as a lifelong marathon of engaging. And I think for therapists who appreciate culture, I think we have to find and support those other clinicians who are doing that as well, and create community out of that uh, to help us grow. And yeah, I'll end there.
Dr. Guillory, always a pleasure. Thank you for making time for this powerful interview. And that's it from me.
Okay,
Thank you.
thank you.
Bye-bye.
Bye bye.